How to submit a QHP application. Issuers seeking to offer qualified health plans, or QHPs, including standalone dental plans, or SADPs, on the federally facilitated exchange must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to fill out several templates with issuer and plan level data. These templates, along with any supporting documentation submitted, comprise an issuer's QHP application. Issuers offering QHPs or SADPs in federally facilitated exchange, or FFE states, submit the majority of their QHP application materials in the Marketplace Plan Management System, or MPMS, module within the Health Insurance Oversight System, or HIOS. The MPMS module is a web application that allows issuers to submit QHPs and SADPs to CMS for review and certification, as well as validate plan data prior to submission. All issuers seeking certification, regardless of state exchange model, require access to the MPMS module, although issuers in states performing plan management functions and state-based exchanges on the federal platform, or SBEFPs, will continue to submit the majority of their QHP application data to their states through the System for Electronic Rates and Forms Filing, or SIRF, before that data is transferred by their state to the MPMS module. Issuers in states without an effective rate review program and issuers that do not have access to SIRF use the URR submissions page in the MPMS module for the rate review submission process. For more information on submission systems issuers use to submit QHP application materials, including guidance on how to access those systems, visit the Submission Systems webpage of the QHP certification website. For more information on which submission systems issuers in different state exchange models use to submit each QHP application material, reference the QHP Certification Issuer Toolkit posted on the Application Submission webpage of the QHP certification website. The MPMS module is divided into 5 primary sections. Issuer Dashboard, where issuers access announcements pertaining to their applications, metrics about any applications they may have started for the current plan year, and easy navigation to other areas of the system. Plan Validation Workspace, where issuers upload QHP application templates for validation and receive validation results prior to submitting their applications. QHP Applications, where issuers create or edit applications, link valid templates uploaded in the Plan Validation Workspace to their applications, complete attestations, provide supplemental application documentation, and access review results provided by CMS. URR Submissions, where issuers in states without an effective rate review program and states that do not use SIRF for rate review purposes will link and submit rate filings, and Application Tools, which includes the Application Materials page, where issuers download certain materials, Issuer Details, where issuers update their machine-readable index URLs, and Plan Preview, where issuers preview and validate the accuracy of their plan benefit displays for healthcare.gov. FFE issuers submit the majority of their QHP application materials in the QHP Application section of the MPMS module. Issuers in states performing plan management functions and SBEFPs submit some QHP application materials directly in the MPMS module, but must work with their state to ensure successful transfer of the majority of their QHP application data from SIRF to the MPMS module, so that they can cross-validate and submit their QHP application to CMS for review and feedback. Once you have completed all necessary application materials, resolved all required validation errors and any optional validation warnings, and created and cross-validated your application, navigate to the QHP Applications tab within the MPMS module. From the Existing Applications section, select Edit from the Action column for the application you intend to submit. This will take you to the Application Overview page. A QHP application is divided into individual groups within the MPMS module. Each application group is made up of application sections. The Application Overview page displays all application data and whether it was transferred from SIRF or uploaded to the Plan Validation Workspace within the MPMS module. Each application group displays the date by which it must be submitted to CMS, as well as the last date the group was submitted, if applicable. Individual application sections will display one of 3 statuses: in progress, ready to submit, or submitted. Each application group will display a status of not started, in progress, or submitted. Once all sections within an application group have been completed and display a status of ready to submit, an application group can be submitted and the Submit Group button will be enabled. Select Submit Group to submit the application group. Then select Yes, Submit this group to submit the application group. If you would like to make additional changes to this application data or are not ready to submit, select No Continue Editing or Close. Once submitted, a green success banner will display at the top of the page if the application group was successfully submitted. The application group, now in its submitted status, will indicate the date it was last submitted. Application sections within the application group will also display a status of submitted. A message below the application group will display, indicating the submitted data is under review, and that while you may continue to edit sections, you cannot resubmit until applicable reviews are returned. Attempting to submit an application group will automatically run cross-validation checks on the applicable application data. Issuers are encouraged to cross-validate their application data in the Plan Validation Workspace prior to submitting application groups in the QHP Application section of the MPMS module. If applicable, issuers should also run additional cross-validation checks in specific application sections until all errors are resolved. If there is an issue when attempting to submit an application group, you'll be directed to a page detailing the specific cross-validation error or warnings found, the severity level, the cross-validation message, and the impacted values. You may click Download CSV to download a copy of your results or resubmit the application group to see the error message again. You must make all the necessary corrections to resubmit the application group for review and run additional cross-validations. Some application groups will be locked while CMS conducts reviews on the submitted data. You will not be able to resubmit a group until CMS completes all applicable reviews for that group. Some review areas are rolling, meaning applicable application groups will be locked for resubmission while the review is conducted. Other review areas are round-based, meaning applicable application groups will not be locked based on these reviews, and issuers may resubmit application groups after all applicable rolling review results are made available. For more information on which review areas impact the locking of application groups, refer to the QHP Certification Issuer Toolkit posted on the Application Submission webpage of the QHP Certification website. The CMS Feedback tab is generated within the Application Overview page upon submitting any application group with associated reviews. Issuers may access review results within the CMS Feedback tab, which contains tables of review results organized by application group. Issuers can also view the review name, status, and date of submission for the data reviewed within these tables, and the date the review results were shared. The CMS Feedback tab will display one of the following statuses for each review. Under Review, if CMS is conducting reviews on submitted application data. Corrections available, if CMS has completed the review of submitted data and identified corrections for the review area. And No Action Required, if CMS has completed the review of submitted data but identified no corrections for the review area. As CMS completes reviews of the submitted application data, issuers will be notified via email of new review results being made available for their review in the CMS Feedback tab of the MPMS module. Issuers will receive this notification even if CMS did not identify any required corrections. For any review areas with a status of corrections available, select View Feedback to review the identified corrections. Issuers also have the option to select Download All to download all available review results across all application groups. Selecting View Feedback allows issuers to review the identified corrections for the applicable review area, including the correction code and correction message. Issuers have the option to download these corrections by selecting Download. Review any identified required corrections closely, including any additional feedback provided by CMS. Continue to submit all application groups that are due by the applicable submission deadline, making required corrections as needed based on CMS's review of the submitted application data. If you have questions regarding how to navigate and use the HIOS MPMS module, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.